This short video discusses blood tests, what they are, what they look for, their importance, and tips on how to help you and your child cope with these procedures.
When a sample of blood is taken, it is sent to pathology. The pathology staff have the equipment that allows them to count the different types of cells in the blood. These numbers represent your child's blood count. Blood counts are frequently checked during cancer treatment to monitor your child's response to treatment. Most of the time, your child's blood counts are at a level that allows him or her to fight infection, have normal levels of energy to play, and to prevent bleeding. During the times when your child's blood counts are normal, they should be encouraged to take part in normal play and school activities. Your doctor will be happy to provide more information about the types of activities that your child can participate in. Chemotherapy not only kills rapidly dividing cancer cells, but also normal rapidly dividing cells in the body. Many of the immediate side effects of chemotherapy are the result of damage to these cells, such as blood counts dropping, hair falling out, and mouth ulcers. The bone marrow is the factory where blood cells are made. Chemotherapy affects the cells in the bone marrow, which can result in low blood counts. Low blood counts may delay or change the treatment planned for your child. Low blood counts may result in unplanned admissions to the hospital. Blood counts reach their lowest about 7 to 14 days after chemotherapy. You'll often be at home during this time, so it's necessary for you to be aware of what to look for, what to do, and when to call the treating team. The three main types of cells we are interested in when we talk about blood counts are red blood cells, white blood cells, and platelets. Red blood cells carry oxygen around the body. A low red blood count is called anemia. If your child is anemic, they might have the following signs. They may be pale, tired, have a headache, feel dizzy, feel cold, or become short of breath during activity. Please call for advice if your child is experiencing any of these symptoms. A blood transfusion may be required if your child's red blood cells are too low. There are several different types of white blood cells. The ones that fight bacterial infections are called neutrophils. A low neutrophil count is called neutropenia. This means the child has very little resistance to bacterial infection. Neutropenia usually happens about 7 to 14 days after chemotherapy is given. If your child is unwell or has a temperature 38 degrees or above, you must call immediately for advice, as this can be a life-threatening situation. A low platelet count is called thrombocytopenia. Signs of a low platelet count include bruising easily, bleeding from the nose or gums, and tiny purplish freckles called petechiae. If your child has a blood nose that doesn't stop, bleeding gums, or lots of new bruises, you should call for advice. The timing of taking blood tests can be very important. Blood tests are often required the day before planned chemotherapy. This helps the treating team know if your child is ready for the next chemotherapy, or if a dose change is needed. Blood tests will also be taken before some procedures, such as lumbar punctures, to make sure that it is safe to go ahead with the procedure. In the case of lumbar punctures, platelets will be checked and a platelet infusion may be given to reduce the chance of bleeding. Blood tests are also taken after chemotherapy is given to watch how your child responds and to provide any treatment, such as transfusions if needed. You do not have to come to hospital for every blood test. It can take up to a day for blood tests to be processed and results to be available. Please talk to your healthcare team about when and how to expect blood test results. When your child's blood counts are low, you can help by cleaning your hands often and well with hand sanitizer or soap and water. Avoid crowds and enclosed places. Avoid sick people. Have good hygiene. Shower or bathe daily. Ensure good oral mouth care. Never use rectal thermometers or medications. Teenage girls should not wear tampons. Do not clean out litter boxes or bird cages or handle animal excrement. Call your healthcare team immediately if your child is unwell or they have a fever above 38 degrees. Children with cancer will require many blood tests during their treatment. This can be quite overwhelming at first, but there are a number of strategies that we have found helpful in assisting children through this aspect of treatment. An important coping mechanism for your child is to have you or someone else they trust there during a blood test. We also have procedural pain clinicians that work with you and your child to reduce the fear and distress associated with procedures. Children and their families are supported to develop various age-appropriate skills and coping techniques that they can use before, during and after procedures to make their experience of treatment more tolerable. Strategies such as sticker charts, bravery charts or special beads that are collected can help children have a sense of control and achievement. Older children and adolescents will also benefit from similar strategies and can work with the healthcare team to develop their own comfort plan that can help them through painful procedures.
In summary, this video has explained to you why we take your child's blood test and what we're looking for. Additionally, we've explained the different types of blood cells and the effects of chemotherapy on cancer and normal body cells. Usually blood counts will recover on their own. Sometimes transfusions are needed for low red blood cells or low platelets. Your child may also need to be admitted for antibiotics if they have a fever or if they are unwell. Please remember to call your healthcare team immediately if your child is unwell, if they have a fever above 38 degrees, or if you're concerned at any time.
Contact your treating team if you have any questions or concerns. You can call anytime, day or night. There is no such thing as a silly or trivial question.